name's Kieran Hixon, and my wife Liz had a brain tumor, and she passed away almost 2 years ago now. I just ignored my whole life. Like, it didn't matter. Didn't matter what I needed. It mattered what she needed. Right then, I just got diagnosed with. Well, no. I have to go to a specialist to get officially diagnosed with rheumatoid arthritis. There are medical journal articles talking about the correlation between grief and rheumatoid arthritis, and I'm just like, well, yeah, what's the cure for that? It's hard for me to go to a doctor. I have this fear of having to deal with all this crap again. You know, why go to the doctor? You know, I've gotten really cynical. I have this feeling that there's either a pill for it or you die. In my head, I immediately go to the worst case scenario. I was like, oh, great. So I'm going to get billed 5 times for the same thing, and then I'll have to fight that thing, and then I'll have to get approval from that thing. I know, and I don't have the energy for that. I don't have, I can barely function. I just got to a point where I just couldn't do anymore. I just let things fall, and I knew I was letting things fall, but it's like, you know, somebody'd come by and they're like, you know, why is there rotting food in your fridge? And it's like, because I can't deal with it. Yeah, the dishes are piled up because I can't deal with one more thing. Pretty much it popped my little brain. There's one nurse in this one hospital right before they sent us home on hospice. And she was, I think nurses are really, they go above and beyond. And I was having, they were talking oh, you know, we're sending you home on hospice. And I know what that means. You know, I'm like, oh, my wife's gonna die, you know? And she was trying to get me to fill out forms, because of course there's forms. And I couldn't take it, and I sort of just snapped. And I knew, kind of in the back part of my brain, I'm like, of all of the people that I should snap, she's the nicest one. And I'm yelling at her, you know, awesome, right? And she's been there, you know, half the nights helping me with Liz, and her customer service back was so awesome, and she did such a great job. And I kind of just was in the moment. I couldn't really process that, but a couple hours later, I went and found her, and I was like, what customer service module did you ever take? Because I want to know what that was. That's when she told me about trauma-informed care. I assume you're having the worst trauma moment of your life, which at the moment I was. And I kind of was thinking about that, man, if you could even take half of the billing agents and insurance company people and at least give them that, you know, so they could find some friggin' kindness. Because what I needed was big kid gloves and simple sentences, and you know, my ability to take in information was changed, and I just needed somebody to be nice to me, you know, and walk me through it slowly and listen. And I didn't get any of that, you know, from them anyway. It's a really nice nurse.
Here's another example of why we need universal health care. In our America, the decisions are made by those who show up. Will you show up? Please click on the like icon below. If you want to know when we release new videos, click on the subscribe button.